If your baby was recently diagnosed with HIE, you've probably come across medical terms and test results that no one has really explained to you. And one of the most important tests often performed right after birth is called an umbilical cord gas analysis. This test can reveal a lot about what may have happened during labor and delivery. And what I want to do is today I want to break it down to you in a way that's easy to understand so you can feel more informed about your baby's condition. So let's start with what an umbilical cord gas analysis actually is. When your baby is born, the umbilical cord is often clamped and cut. But before that, doctors can draw blood from the cord to test it. This test measures things like the pH level and the base excess in the blood, which tell us how well your baby was getting oxygen during labor. If the oxygen levels were too low, it could signal that your baby was under stress and struggling before birth. Now let's take some time and let's talk about the actual numbers that you might see if you're looking through your baby's records. These can feel intimidating, but they're important to understand when you're trying to figure out what might have gone wrong during labor and delivery. One key measurement is the pH level. For umbilical cord blood, a normal pH is often considered above 7.2. Some medical sources might use a slightly higher number at 7.25 as the cutoff. When the pH drops below 7, it's considered a sign of severe acidosis, meaning your baby was more than likely not getting enough oxygen during labor. Another important number is called the base excess. This measures how hard your baby's body was working to compensate for stress during delivery. A base excess that's greater than -12 is a strong indicator that an acidotic event occurred during labor, according to guidelines from organizations like ACOG. While these thresholds can vary slightly depending on the source, the key takeaway is that low pH and high base excess can confirm that your baby may have been experiencing oxygen deprivation at the time of birth. Now, why does all of this matter to you? These numbers don't just explain what happened, they can help uncover whether the medical team missed signs of distress during labor. So for example, if the pH was dangerously low, but doctors didn't perform an emergency C-section in time, that delay could have contributed to your baby's HIE brain injury. By looking closely at these types of results alongside of the other things in your baby's medical records, we can determine whether the standard of care was followed during labor or delivery. I know these tests, they might seem like just a lot of more paperwork in an already confusing process, but they can be a very powerful tool for finding answers. If no one has taken the time to go over this information with you, you're not alone. Many parents are left in the dark and they're trying to make sense of what happened when they see things like this, cord pH and base excess. If you have went through the records and you've seen pH and base excess or umbilical cord gas in your baby's medical records and want to know what might that mean for your baby's diagnosis, don't hesitate to reach out. You deserve answers to these types of questions in the context of your baby suffering an HIE brain injury at birth. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me if you click on my profile, or you can just wait and take a look at the picture that follows this video. All right, that's going to be it for today's quick educational video. Have a great weekend, everybody.